Hello class, this is Megan Bateman. I did my presentation on preeclampsia. That's my topic of discussion today. The next few slides will give you information on preeclampsia, what things the mother and baby go through with this disorder. So, first question is, what is preeclampsia? Well, preeclampsia only occurs during pregnancy and affects only about 5 to 8% of pregnancies. This is a rapidly progressive disorder and affects the mom and the baby. The onset of preeclampsia usually occurs after 20 weeks of gestation, but it also can occur postpartum, but very rarely will even occur before that 20 weeks of gestation. This disorder makes for very poor perfusion of the placenta, which in turn makes for decreased nutrients being transported to the baby during the pregnancy. This can make for very low birth weight, decreased vitamins and minerals, and can make for the baby to be in stress. So what are some treatments for this disorder? The biggest one is to give birth to the child. This can't always happen if the onset of the preeclampsia is during a non-viable gestation period. The mom can be put on magnesium sulfate, which in turn can be called a mag drip, which helps prevent seizures and also decreases any early contractions that mom can be experiencing. Mom may be put on bed rest with minimal movement to continue to, per se, cook baby inside. Another thing that is given to moms is antihypertensive medications, and this is due to the increase of blood pressure that will occur. Mom may also receive steroid injections. This is to help form the baby's surfactant levels to increase lung capacity if, per se, baby does have to be given birth, if mom has to give birth early on, a baby being born early. The onset of preeclampsia is currently unknown. There are some theories out there that the onset could be due to possible changes in biology of the placenta, or due to the fact that there are a variety of hormones and proteins within mom's circulation that can cause changes in the placenta and mom's total makeup. So how can we kind of prevent this? So not per se preventing overall, but just, keeping ourselves healthy is kind of the biggest thing. Any pregnant mom what they can do is continue to do their prenatal care. So attending their doctor visits, taking prenatal vitamins and minerals, and to continue their doctor visits regularly. Eating healthy, maintaining healthy habits are always helpful for any pregnant mom and baby growing inside of her. A big thing that can be helpful for yourself and for your doctor is knowing your baselines. So, knowing your baseline of your weight. How do you lose and gain weight? I mean, us women, we know how we can gain weight quickly or how we can lose weight quickly. You would notice if there was a big change. Along with your blood pressure. What is your baseline blood pressure? Not everybody's is 120/80. What do you run at normally? And kind of just watch that as you go with your pregnancy. Some symptoms. What are some symptoms that can occur during this disorder? Well, these symptoms shown here on the slide can be just from a woman being pregnant. So you might not even notice, per se, symptoms. Many pregnant women have nausea or vomiting at some time. They might have the lower extremities of edema, might get a headache, and that's that change in your hormones. Many women have these symptoms as a regular thing when they become pregnant due to the changes in their hormones. But when these symptoms become persistent or increase rapidly is when something should be taken into consideration, that something may be wrong. Big thing with edema, something that is noticed more is if they have edema more in the face, eyes, and hands compared to a lower extremity. Also, that sudden weight gain. So 2 pounds a week increase would be something that would be a symptom of not a normal pregnancy. Also that hypertension, knowing your baseline of your blood pressure and knowing what you should be at all times. And also protein in your urine. Doctors will always do urine testing, so I mean they can test for any proteins, excessive proteins in your urine, and this is due to the temporary damage to the kidney, which is your filter. So it makes that protein pass through right to your urine. So overall, preeclampsia is not very well known for the onset of why it occurs in women, but it can be a very scary thing for a pregnant mom. I was one of the small percentage of pregnant women that was diagnosed with this disorder. My son Oliver, as you can see on the left, he was born at 30 weeks, 5 days. He weighed 2 pounds, 8 ounces. I was on bed rest at 22 weeks of gestation. So I was in the hospital until that 30 weeks. They put me on the MAG drip, that MAG sulfate. It's a very hard thing to watch any pregnant woman go through that. You get very dizzy, you get very hot, you can't stand, you can't do anything. It's a very hard drug to take. This is not something that should be taken lightly. If you or someone you know is diagnosed with this disorder. Also, once you have preeclampsia, you're considered a high-risk pregnancy. So any other children you plan to have, you will have even more doctor visits, testings completed, just so that they can try to consider this, make it so it doesn't happen again. So, like I said, this one right here was, the one on the left was Oliver when that was the second day of his life, the first time I actually got to hold him. So if you moms out there think, hey, I got to hold my child right away, I didn't hold him until he was, a day old. And as you can see, there's lots of tubes. He had a TPN tube, which was right in his belly button, to give him his sugars and help him with his levels. And then he was actually intubated when he came out, so he was not breathing. And I didn't see him like that, and now he is actually going into kindergarten this coming year. So he is still a very small little boy. He's only 46 pounds and he's almost 6. But he's a smart kid. So really, we took the best care that we could. We did the steroid shots. We did all of those things to prepare for a small child. So it can happen. And resources, here they are. And